stressful on the voice. And this song was allowing me to have those high lilting tones, which I enjoyed very much. So yes, that was a wonderful time.
Stan, I was just wondering if you could comment too, around this time, what you were experiencing.
Well, it's important to be a support person as she's going through all of these trials and tribulations and is starting to get her voice back. And every voice patient needs to have an encourager. This could be a family member, this could be a spouse, this could be a good friend, or it could be all of these. And they would encourage, the necessity would be for them to encourage and to help take care of chores around the house so that provide little practice time. And could be transportation through snowy weather, and just any number of things to support the person that's going through this long process.
And I might say that he would listen to me practice, and then he would say, I think you've done enough, or yes, I think you can do a little more, because he had heard me sing so much that he recognized when it was healthy and when it wasn't. So it was a very good, helpful thing for him, because I often would tend to want to sing more than I should.
Tessa's situation is really not unique. It's very common for me to see, especially women who have been singing all of their lives. Most of them come into my office not as late as she did. I think Tess had an incredible amount of reserve and good training that sustained her through most of the course of her life. But the average age of the patient that I see is about age 50 to 53. They're typically in the church choir. Their entire social life revolves around their interactions with the people in the choir. And they come in because one day they realize they can no longer hold their weight in the choir. And individually, each person is in tears. This has had a profound effect on their life. So when Tess and Stan tell you how discouraged they were, I can tell you she was in tears in my office. And that has a profound effect on me as a physician. It makes me want to help them to do their best. But as you can see, a lot of it has to be internally motivated as well. During the time that Tess was working with Melissa and with Dr. Porterfield, I was also allergy testing her, placing her on allergy shots, treating her acid reflux medically. Her dentist was working with her and had made a splint for her, and she came into the office wearing the splint to help relieve the pressure on her temporomandibular joint, or TMJ, to help relieve that. She was working with another physician regarding her fibromyalgia. And so there was a very strong integrated approach to getting her to a point where she would be able to sing again. When patients come into the office, they have perceptions and they have expectations. One of their perceptions, and it's a false perception generally, is that they have a vocal cord cancer when they've been hoarse for several months. Frequently, the cause of hoarseness is going to be an inflammatory cause, such as allergy or acid reflux. But it is extremely important to do a proper evaluation to put that fear of cancer behind the patient, because sometimes the patients do have cancer. But I want to emphasize that that's rare. In addition, there's always the expectation of the so-called quick fix. Doctor, you're a surgeon. Why don't you just operate on my nodules, remove them, and I'll be much, much better? The reason we don't is that surgery always produces one common side effect, and that's scar tissue. We've already seen that in Tessa's case, vocal cord nodules can be expertly handled by the speech-language pathologist, as in the case where Melissa worked with her, and on follow-up examination, the nodules were gone. Had I operated and removed the nodules, then Melissa would have had to work with scar tissue, which can't be removed. Much, much better to take the long, patient approach than the quick fix. At this point, I'd like to get Melissa's observations on Tessa's care.
When Tess first came to me, I still remember to this day, the best way is I could probably demonstrate it. She came in and she had a lot of her throat and facial tension and very horse-like voice quality. But she talked kind of like this, and that was huge. I just wanted to cry because I felt like I could tell it hurt, and we were very upset.
Yes, I was.
And we discussed how long it would probably take, and she gave no timeline, which was great, which I understand sometimes that's not, you have some people who need to go back to work, they need to talk, but it is a lifestyle change, and that's something that, that needs to be taken to heart. You know, are you willing to make that change? And even once you get to a point after all of the exercises, you know, vocal exercises, the vocal rest, and deleting all the behaviors, is you have to make sure that you follow through with it even after your voice is returned. And so, Tess, can you elaborate on that a little more?
Well, I'd like to explain that when Melissa said to go on voice rest, that was not a foreign concept to me because I had known about voice rest as a singer. So I made a little tag and wore it, and the tag said, I am on voice rest. I cannot speak, but I can listen. Please talk to me. I love you, Tess. And it really worked. And I wore it everywhere. And that allowed me the privilege of being able to go to church and go places and be with people and still not have to just talk and explain everything. So it does work to wear a little tag.
Just going back 1 second also, Stan, I think that in your role, you can be a little more objective also, and you're evaluating Tess on a more constant basis than any of us. Did you have any insights as to what might have caused her problems?
Dr. Ford, when we got the diagnosis from you that she had nodules, on the way home, she said, how do I have nodules? She said, I have taught people to sing all of my life so that they would not get nodules. And now I have nodules. I don't understand it. That night, Tess had a fibromyalgia attack. She had muscle cramps in both lower legs and in her upper thighs. And she was in excruciating pain. And she was screaming out in pain. And I said, honey, look at your voice, your vocal cords. And she said, and she was all tense. And then she says, I understand.
Now, the other person that's integral is Dr. Porterfield. And I think we should hear from her a little bit more detail as to the progression of how she and Tess went through with her vocal coaching and with her singing process.
At this point, I would like to make a few observations about Tess's situation in particular, but also how it can apply to any of you in the audience who are undergoing a series of treatment options for your vocal distress. Because today we're using Tess as an example of that, but we would like, although Tess's own individual situation is unique to her,